In this video I want to go over the bone features for the skull. Let's first talk about the bones, the cranial bones. You have the frontal bone, you have two parietal bones, temporal bones on the sides. All the way in the back you have the occipital bone, and then in the back of the orbital you have the sphenoid, and then over here the ethmoid. You can see the sphenoid also from the side. In addition to that, there's facial bones, the maxilla, the nasal concha, the vomer, the mandible, the zygomatic bone, the two nasal bones, the lacrimal bones. So those are the bones of the cranium. Let's talk about the sutures. So the coronal or frontal suture is found between the frontal bone and parietal bones. The sagittal suture is found in between the two parietal bones. You have the lambdoid suture between the occipital and parietal bones. And then you have the squamous suture between the temporal and parietal bones. Okay, so let's look at the front first. These two holes above the orbital, they're called supraorbital foramen. Down below you have two, those are called infraorbital foramens. If you look all the way in the back of the eye, you can see parts of the sphenoid bone, the superior orbital fissure, and then over here you got the optic canal or optic foramen. So those are features of the sphenoid bone. Inside the nasal cavity you can see part of the ethmoid bone. This is the perpendicular plate of the ethmoid bone, and then down here is the vomer. You can see the nasal concha, the inferior nasal concha, and then the superior and middle will be actually part of the ethmoid bone. When you look at the maxilla, you can see these little bumps or processes called alveolar processes. You can see the same processes down here on the mandible. Speaking of the mandible, this is the mental protuberance, and these are both mental foramen. Over on the side you can see the temporal bone, the external acoustic meatus, the mastoid process. The styloid process and mandibular fossa are seen a little later on a different view of the skull. But this is the zygomatic process, right? This is going to make a connection with the zygomatic bone, and together they make up the zygomatic arch. Looking at this view of the skull, the lid has been removed, so now you can see some additional features. This space right here is the anterior cranial fossa, the middle cranial fossa, and in the posterior cranial fossa. You can see the ethmoid bone with the crista galla and the cribiform plate. Those little holes are the olfactory foramina. You can also see the sphenoid bone with the optic foramen, the sella turcica, the lesser wing, the greater wing, and the body. You can see the foramen magnum, which is the large hole in the base of the skull. And then you can see over here, this is the hypoglossal canal. You can see that on both sides of the foramen magnum. Okay. Over on this, oh, by the way, you can also see the internal auditory or acoustic meatus. That's this hole, and that leads over here to the outside, which is the external acoustic meatus. This is the inferior view of the skull. You can see the maxilla making up part of your hard palate, and then the palatine bone, which you couldn't see from those other views. And the vomer is also visible from this angle. The zygomatic arch is more visible. Lots of foramina on the bottom of the skull. You don't need to know them all, just some of the major ones. So this is the jugular foramen. Okay, so that's where your jugular vein, and over here, that's where they come out. Right in front of that is the carotid canal, or carotid foramen for your carotid artery. I mentioned the foramen magnum, but then you can see on both sides of that occipital condyles. So that's going to make contact with C1, the first vertebrae. Over here you have the bump on the back of the occipital bone. That's called the external occipital protuberance. And now you can see better parts, a better view of the temporal bone, at least the inferior parts. So this is the mastoid process, this is the styloid process, and then right here in this model they have a little rubber. This represents the mandibular fossa. So what's going to happen there is that where the mandible sits in and forms your temporal mandibular joint. So while we're at it, let's talk about the mandible. So you got the parts of the mandible, the ramus, the angle, and then the body. I mentioned the mental protuberance in the front, and then the two mental foramen, the alveolar process, of course, But over here, this is the condyloid process, and at the top is the mandibular condyle. This is the mandibular notch, and then over here is the coronoid process. Okay. So those are the parts of the skull.